Okay.
As Nyikal, I believe there's enough money in this country to run our health services. Now, what is the key that will open this, in my view? If we could get the public health services to where they were in the mid-70s, even into late 70s, I know it will be hard for you to believe that there was a time that Kenyatta Hospital was better than Aga Khan. It will be hard for you to believe that when my first daughter was born in 1979, maternity in Kenyatta, which is now the MTC office block, was actually better than maternity in Nairobi. We can get there. If we get there, so that the public facilities give what is acceptable level of care. We are not talking of when you go to a bed, you have a TV and there's a menu, you are taking the meals. That's not here. That's out. If we get that, like, let me say, if you know the level of maybe Avenue here, or even Avenue Kisumu, a little bit around MP Shah, or maybe a little lower. If you got that level, or a well-running mission hospital, you go to a place like probably Nazareth. If we can get most of our people getting care there, NHIF would cover most of the cost. If we rub fraud, we have not gone deeply into fraud. We thought we would.
Let's get in there, because I asked him about the fraud, and he talked about
if that was taken care of. Now this mandatory should be compulsory. Mandatory means compulsory. We should even find ways. If things were okay, I know I'll get treatment. It would therefore, the government would be justified to say, if you do not have evidence that you have paid for NHIF, you are even denied some services, which means you can't go and get your driving license if you don't have NHIF.
Okay.
Now, let me tell you, I don't think it's a fun. Japan were very, very strict. Difference because them, they started with people providing health for themselves. So people are hard on each other. People are being chased. So if it's mandatory, it's mandatory. Why we have a difficulty of punishing people for not paying NHIF is because we don't have a service which they are consuming without paying for.